When the assistant's seated with the doctor for treatment, they should be about 4 to 6 inches higher than the operator or the doctor. That way they can have a clear field of vision looking directly into the patient's mouth. The light should be at an arm's length above your head. That way it's easily changed or moved, and that way you also don't bump your head when you are assisting or need to look into the patient's mouth. The air water syringe has a button for water on the left and the air on the right. When you push them together, we use the spray, and that's what is most often used. This is considered the pen grasp for the HVE. This is your most common way that you will handle and maneuver the HVE when assisting. Another grasp is the palm grasp. This one is used more common if it's a difficult retraction or you need a little more strength. All right, we're going to show you how to rinse just an isolated tooth that you would be working on. You want your suction to be parallel with the arch. You don't want to come at the tooth sideways like this. You want to come in more of at an angle. Turn your suction on, and you're going to be right over the top of the prep with your air water syringe and your suction at the same time. And you're going to do this spray again, so you push on the air and the water button at the same time here. Right over the tooth, just for a couple seconds. Get any water that collected in the back. Dry, just air over the prep. That way the doctor has a clear visual to see if there's any more decay or how the restoration or prep looks. And then the patient could also close down, so you always want to pop out so the patient can take a break if they need to after you've rinsed. All right, we're going to show you how to give the patient a rinse. So a lot of times you're going to have your suction in your right hand and your air water syringe in your left hand. Your air water syringe should follow the suction wherever it goes. So if it's over here, your air water syringe is over here. If you go on the right side, your suction follows. To rinse, you have your water and air button. We're gonna do what we call a spray, where you're actually gonna hit both buttons at the same time. So to collect all the water, because gravity works against you, make sure your suction is on. And then you're gonna push on the buttons at the same time. And I'm gonna make a full rotation in the patient's mouth. Gather the water over here, and then go to the opposite side. And the bevel of the suction should always point towards the back of the throat, and you should always see this little vent hole as well. We shouldn't have it going this direction because you're going to suck up the cheek every time. So make sure that the vent is where you can see it. That way you don't get the cheek or the tongue in the way. HVE placement for the maxillary upper right would be on the lingual or the palatal side of the teeth. HVE placement for the maxillary anterior would be either on the facial side or the lingual, depending if the doctor's working on the lingual or facial of the teeth. The maxillary upper left, your HVE is positioned on the cheek side, or what we call the buccal side. You would use your air water syringe to retract the patient's cheek as well. The mandibular lower left, the HVE would be positioned on the buccal side of the teeth, and you again would use your air water syringe to retract. The mandibular anterior, you would be positioned on the lingual or opposite of wherever the doctor's handpiece is. And on the mandibular lower right, your HVE would be positioned on the lingual side of the teeth. You would also need to retract the tongue with your air water syringe.